Zach, did you want to introduce who's speaking for HSC since you have the list?
Absolutely. Sorry, I am on the road right now, so I have just my laptop.
Okay.
But my name is Zach Dawkins. I am the Assistant Director of Admissions here at the University of North Texas Science Center. And I have a couple of faculty here to talk to y'all today. Going first is Dr. Kerr. She is the overseer, who is one of our faculty for the pharmacy program. So I will go ahead and let Dr. Kerr take it away, and then Dr. Benavides, and then I will finish off for us.
Excellent. Thank you, Zach. So good evening, everyone, and thank you for joining us this evening to learn more about our programs. As Ms. Asbury had mentioned, my name is Dr. Marcel Satsky-Kerr. I am a professor in our Bachelor's of Science program in Biomedical Science. It is the Health Science Center's first ever bachelor's degree, and we have graduated our first class this last December 23. It's a pleasure to see you all, and I look forward to answering your questions. This is a bachelor's degree completion program, which means students will need to finish the first 60 hours, and that includes general education requirements, Texas core curriculum requirements, which are basically the same thing, at a community college first, and then transfer to us after they've completed 60 hours. TAB students are automatically, right, they meet those objectives. There is one prerequisite course that they do not have in their curriculum before they come over, and that's Organic Chemistry 1. But we have a way to admit them and let them continue to take that at community college when it is offered. Let's see if I can advance here. All right, so some highlights about our program. First of all, this is a new program, so we get to hire faculty from scratch, and we basically went out there and found the best and the brightest. So these are all faculty who teach in the program. They are full-time in support of this program. You can see their expertise in the bottom of each of their pictures, but more importantly, we hired people who are passionate and experienced at teaching undergraduate students, because that's very different than teaching graduate and professional school students, which historically is what we do at the Health Science Center, as well as their experience teaching online, because this is a completely online program. It's also asynchronous, which means students never have to come to campus. So it's really geared for those students who have competing responsibilities. Maybe they're working part-time, full-time, taking care of maybe taking care of children or helping their parents out, things of that nature, or some combination. So it's very flexible to work around any other responsibilities that they have. Also, I always like to mention this to TAB students and other students. If their first experience learning online or teaching online was during the pandemic, that is not the experience they're going to have in this program. Believe it or not, we have been teaching and learning how to teach in a virtual classroom for over 30 years, which means we've got best practices on research on how to teach online and do it well. And so we have created this program with those best practices in mind. This is a bachelor's of science, which means it's a terminal bachelor's degree that prepares you for anything you'd want to do next. So just as your child has been geared in a health science specific curriculum as a TAB student, this is a healthcare specific degree that you're not going to see at any other regular four-year university, right? So, and it prepares them equally for medical school, dental school, optometry school, to enter or advance in industry, to work in labs, right? Anything that you can think of that's healthcare related, it is going to prepare them specifically for that career. Some highlights or innovations of our program. Again, it's convenience. It's completely online, completely asynchronous, so students do not have to come to class for any requirement, and yet they have all the privileges and rights to anything else that we offer at the Health Science Center. So guest speakers, the library, the fitness center, you name it, they are full-fledged students just like any other university. Again, we've hired knowledgeable and experienced online undergraduate educators. It's very flexible. Going full-time, you can finish this program after you've done your 60 hours at community college or graduated from TABS, right, in this case, and transfer over. You can finish in 1 year or 4 semesters. So if you started in fall, you'd go fall, spring, summer, and you graduate that following fall. Or if you want to go part-time, you can do that as well, because it's a non-cohort start. You can start in fall, you can start in spring, you can start in summer, you can graduate any semester. So it's really created with maximum flexibility for students. We also use an accelerated learning model. So traditionally, higher education is set up to have 15 weeks in the fall semester, 16 weeks in the spring because of spring break, and then a 10-week term in summer. And we do 2 8-week sessions in fall. So there's fall 1 session, fall 2, spring 1, spring 2. And that way students can get more coursework done in a shorter period of time. It's accelerated, which means the same amount of work you do in a 15-week course, you do in an 8-week course. And it's structured this way because this way students take 2 courses at a time. They're really dedicated to just 2 subjects. They get our help, right, with that content, and they learn that information better. So research shows that students, adult learners, do much better when they're focusing on just 2 courses at a time, as opposed to like 15 hours or 5 different courses at a time. And then, of course, last but not least, is this unique healthcare focused curriculum. It's also very accessible, as I've said. Specifically, there's the asynchronous courses. We have program dedicated academic support, a student navigator for the program, which is like the student's liaison. The second you are admitted to the program, you're assigned a full-time faculty member as your mentor that helps you with elective course selection, really personalizing your degree for whatever your next step is, creating your degree plan, helping you with career coaching, things to that nature. The HSC has excellent tutoring services, career preparation. We know students are busy too. The Career Center is often like the library. I know it's physically there, but if you don't make me go to it, I'm not going to go to it. So we bring the Career Center into our curriculum, and we actually have the director of our Career Center teach our career readiness course with us, so that the students are getting their resume development, they're getting it revised and reviewed by an actual director of a Career Center. Again, we have a full range of student services, including mental health and well-being, and it's affordable, right? We're public Texas tuition, and so our cost is about $375 per credit hour, which I know sometimes that's confusing, but like you can basically Google UNTHSC tuition calculator, and you'll be able to plug in however many hours you want to take. You'll see exactly what the cost is for an entire academic year. All right. Our program is an institution is fully U.S. financial aid eligible, right? So similar to other institutions, we do have dedicated admissions scholarships. So we award these at admissions. They're based pretty much on the student's academic performance and that fixed first 60 hours that they took. And again, there's the cost of our tuition. Some other perks about the curriculum is that not only do we have these faculty who are subject matter experts in, biochemistry, psychology, the different courses they're going to get, but we also know that whatever their next step is, they're going to need to be able to have a soft skill set or marketable set of skills. And so every single one of our courses requires students to interact with a human 25% of all the requirements in the course or higher. So they're not just reading lectures and working by themselves, right? They're not going to be lonely, right? They're interacting with faculty, their peers, and teaching assistants in the course every single week. We also have hands-on lab. There are wet labs. So we create wet lab kits and we mail those directly to the students. And we also give them videos on how to do those labs so they can watch it over and over again, right, in case they missed a step. We also have students read and critique empirical research articles, because at this point in their curriculum, in their careers, they've pretty much only read textbooks. Textbooks are great, right, for general knowledge, but they need a skill set of understanding what's in the research literature, what's valid, what's credible, what's reliable. And so we teach them how to find their literature and to decipher what's credible from what's not credible. We also then, after they learn how to read research literature, they actually learn how to do research writing using APA format, which is the world premier writing format for research. At every single course, there's some type of summative project where they're going to be working in groups, because whatever they're going to do next, they're going to be working in a healthcare team with people with very different backgrounds from them. And so we want to help them develop that skill set while they're participating in our curriculum. Other advantages, of course, this program is that the healthcare focus in the co-curriculum. So co-curriculum is stuff we provide students outside of the curriculum, right? So we do workshops on how to get into, survive, and thrive in graduate school, right? Things to that nature, whatever. And we ask the students, we don't just decide what we want to offer them. When students are new in the program, we're like, what are your needs? What are your strengths? And then we tailor our co-curriculum based on the students who are actually in our program. We also have the Health Science Center resources and connections are all available to our students. We have faculty outside of our school who also teach in our courses, so they're getting exposure to the different programs that we offer here at the Health Science Center. We also have a health professions advisory committee, which helps students who want to go on to medical or dental school. We help them with their letters of recommendation and all the different parts and etiquette that you need to know on how to start that process, when you need to start, and we help them each step of the way. And then, of course, we have instructors who also have clinical experience, right? So everything we're teaching them is very relevant. It's very current. They're not getting outdated information. And then again, the faculty mentors helping them with selecting electives. They only need 5 electives, but we're offer 20. And so they have quite a selection to pick the ones that are going to help them with their next step. All right, so what do you need to get in, right? You need to have those 60 college credits, which again, TAB students are going to have. And that will include completion of the Texas core curriculum, a minimum 2.0 GPA across all your coursework. You need to take the 15 or 16 hours of math and science classes that I'm going to cover in a little bit. Of course, we need your official transcripts. Our admissions process is holistic, so there's also 3 essays that students need to complete. And then there's optional letters of recommendation. Again, if they've worked, and have an employer write a letter for them, or if they've done any shadowing with the physician, really anything that they think that would help them in the admissions process, we encourage them to include that as well. So the math science classes that everyone needs in order to be ready to enter our program is they need to have a 4-hour biology course for majors. So that's General Biology 1 or 1406, right, at TCC. General Chemistry 1, again, with its lab, so 4 hours. Organic Chemistry 1, and then a math course at the college algebra level or higher. And so I've got quite a list here, but there's even more. So again, TAB students, as I understand, and Tammy, feel free to jump in to correct me, but TAB students will have completed all of these as part of their degree, their associate's degree, with the exception of Organic Chemistry 1. Is that correct?
So we have a few kids who are tracking to take an organic chemistry during the school year. I have one who tried it and is trying it currently this school year. Next year, I have 2 or 3 that are eligible and interested. So it is possible to work it into the curriculum. Most of the time, these students are going to be our Associates of Science students who have this kind of level of hour work in both math and science. Keep in mind, parents and students, if you're on here, that while General Chemistry 1 is only listed for 4 hours, in order to take Organic Chemistry, they have to do Chemistry 1 and 2. So they're actually getting 8 credit hours of chemistry prior to that organic. But it's very tight in the schedule. So with TCC, currently it's taking up 3 of our periods. That's a large chunk of the senior schedule. So it is limited to who's going to be eligible to take that, but it could potentially be possible for some of our kids, whereas before we were not even able to offer that. So that's new, but it does take some prep. You do have to have those math requirements early because you have to have the college algebra prereq to take Chemistry 1. So just keeping that in mind, parents and students, as you're looking at that, if you're on track to do Associates of Science, sometimes those come a little bit later. Those prerequisites happen a little bit later. And so they may not have the opportunity to take that organic chemistry here with us, but they might at least get the general chemistry in. And I do also want to just clarify, because I know sometimes we live in 2 worlds. The cumulative GPA that Dr. Kerr is talking about is their college GPA, not the high school. So just make that note.
Thank you. Excellent. And again, if you can't get this coursework as part of your degree, you can still take it after you graduate your associates right through TCC. And then when you finish, or when you're taking your final prerequisite, you can apply to our program. So you don't have to have it completely done before you apply to our program, but you can be enrolled in it like that semester right before you plan on entering our program. So here are our next deadlines to start with us in summer. The application deadline is April 1st, but to start for next fall, which would probably be the earliest anybody here would be able to start the program if you're graduating this May, is July 1st. And then there's a QR code there. Students, if you want to snap that takes you straight to our program website that has the entire curriculum. It's got degree plans, just a lot more information about the scholarships, the actual link to the application portal. So lots of that will be right there at your fingertips. And so that I will pause there, and I'm happy to answer any questions. And Zach, let me know, do you want us to do questions at the end and let all the presenters go first, or what do you want to do?
Let's go ahead and do questions after each presentation so that we are getting the right information every time.
Sounds good. Then I will stop my screen share.
I was wondering if the graduates from December, if any of them chose not to go to grad school, were they able to just enter the workforce?
Great question. So first of all, 100% of our students have either done something at community college or got a community college degree. And 90% of them were already working part-time or full-time, and 70% of those working were already working in healthcare. So it's small numbers, I can tell you exactly where they are. 4 graduates, right, graduated this fall, and 1 is advancing or hoping to, like we're writing her letters of recommendation to advance in her career, which is already in healthcare. 2 are applying to medical school, and 1 is applying to dental school. The 1 medical school is applying for this cycle, and the next one's applying for the 25 cycle because he wants more time to take the MCAT. And then the dental student's applying right now. And she's also doing research opportunities this summer to boost her application for dental school. So far, I mean, it's early, right? But they all are going to have, I think, very strong applications.
Thank you.
Mm-hmm. So who's our next speaker?
Dr. Kerr, I didn't know there's also a question about a dentistry pathway in the chat.
Oh, okay. So there's not a specific dentistry pathway, but again, we prepare students equally for dental school, medical school, optometry school. We don't differentiate that. And our HPAC specifically right now helps students to enter the portals for dentistry, dental school, and medical school. Am I answering the question? Dexter, feel free to unmic yourself and make sure I've answered your question.
Yes, thank you.
Okay. Excellent.
Awesome. All right, we will go ahead and move on then. So Dr. Benavides, if you want to do a quick introduction for yourself as well, and then you are more than welcome to jump in and start.
Alrighty, thank you very much. So I am Taylor Benavides. I am a pharmacist and assistant professor in pharmacotherapy and assistant dean of recruitment outreach at the UNTHSC College of Pharmacy. I've been with the college for about 3 years now. We just celebrated our 10th year anniversary with the college. So really, really happy to be here. I wanted to begin and ask, and really go over why pharmacy first, right? So let me go ahead and share my screen with for a few slides I have here. If I can pull this up. Well, I guess while I'm having some trouble, so I will just begin. So why pharmacy? So I always say it's 6 years for 6 years is what I say. So really it's a great way. So I think a misconception is to be a pharmacist, you have to have a bachelor's or even advanced degree. And what's really neat about pharmacy is it doesn't require that. Sometimes you can get just the prerequisites, and you can get your bachelor's as well and then apply to the program. Another thing too is what do pharmacists do exactly? Well, I am an internal medicine pharmacist, so I practice at Medical City Arlington, along with my teaching at the college, but I also practice at Medical City Arlington, and I'm an internal medicine pharmacist. So I'm rounding bedside to bedside, room to room with the physicians, and I get to make recommendations to the team. I'm there making decisions on their healthcare, on their medical decisions, on even some of the procedures that are done, if it's necessary, is it not? And so I think I have the coolest job in the world. But another way to answer that is what pharmacists do, because I know really when I think of pharmacists, before I applied, I really thought, okay, it's HEB, it's Walgreens, it's CVS, and that's just one very, very small sliver of what pharmacy is able to do. And so I like to say, wherever you see a medical doctor practicing, there can be a pharmacist that practices right there with them also. And so if you have, for instance, a cardiologist, we have cardiology specialties that we can go into. If you're talking about pediatrics, we have a pediatric pharmacist, and on down the line. A big one is oncology. We can have oncology pharmacists at work, and they work bedside with the physicians to help make those decisions. And then so if you're considering pharmacy, then why HSC? Well, I think that HSC, in particular our College of Pharmacy, offers what a lot of programs can't, and that's the DFW area. So we are in Fort Worth, and in Fort Worth we have some of the greatest hospital systems in Texas, and so we get to round at these teaching hospitals that really make a difference, because a lot of the hospitals here practice interprofessional care of the patient. And so with that said, they're teaching hospitals. So our students are going on to rounds, and they are giving recommendations, and they get to work on those soft skills that just aren't available to some students at other programs. And I think that's a big one. Then into our faculty, because I think our faculty is what makes us unique also. We have very unique and diverse faculty. We're from a whole lot of different walks of life. We're also very friendly. We have open door policies, and I think we may be different from from professors at our big universities, because we have some students that are scared to come talk to us when they come from big undergraduate programs or even smaller ones. They come here and they're like, "Oh, this is interesting, talking with my professor like I'm their friend, like I'm having these conversations with them." But it's true though. We're really here, just like all of our programs at HSC. We're here for our student success, and we have open door policies. They can come in, talk to us about the class. They can talk to us about their life, anything that we can help them with. We also offer mentorship programs that can help them get to where they're going, because though they're going to have all these experiences, we're making sure that their CVs are fine-tuned to help tell their story, and we're able to define them the experiences, help with their research if they need it to get to the next level, and just really going above and beyond for our students. But I think it's something else that Dr. Kerr also mentioned, and it's our resources. And I really want to really point out just how great our resources at our HSC. I sit on a committee for students that may be struggling, and I've seen students come to our programs like the care team, for instance. They're there just like a lot of disease states. They start to rear their ugly head in our 20s and 30s, and I feel like sometimes that can occur in pharmacy school also. And so we've had students that go to care team, and they have the counseling services that can help these students out. We also have for students, because again, going from a bachelor's program or even high school program to bachelor's, there's a jump in your study habits, but also a jump in your study habits going from your bachelor's into a graduate program. And so we're here to help you make that jump. And so we have the Center for Academic Performance. Even if you're not struggling with studying, they can give you great study tips to learn how to study in groups, learn how to study by your own, and really help you optimize your studying. So you're not maybe having to study so much and as often as you are, and they can make your studying more efficient. And so I've seen students that have struggled, and then they go to these resources that I did not have as a student when I was going through pharmacy school. They go and they seek these services out, and they utilize them, and they excel. We've had students that really struggle in that first year and then are just rock stars for the rest of the program. And so I think those are some really great benefits of the pharmacy program. But overall of HSC, and I think that's resonates across all the programs, is just how great the faculty are and some of these great resources we have too.
Thank you, Dr. Benavides. Appreciate it. We also have time for some questions for Dr. Benavides. If anybody has questions about anything pharmacy related, now is a great time.
Do you want to hit just a little bit on some of those prerequisites, since you were saying you don't have to have a bachelor's degree? Would that be possible?
Yeah, so I think just like a lot of our programs, and I will say this may be a good question for Mr. Zachary for some of our more specifics, but really we require some of those things: Texas core, calculus, physics. We require, again, like I said, 2 years, so you're not necessarily needing all those advanced science and math courses. It's really, again, the calculus, the chemistry, the organic chemistry 1 and 2. Those are the specifics. Granted, now I know there are specifics and why I mentioned for Zachary's, because we are a graduate program. Though if you have your bachelor's, there could be some exceptions we can make for some of our courses, and so those could be specifically asked, and we can talk about those now, or we can talk even after the call.
So I'm curious, because it's an early college, high school to farm doc. What's the pacing for that? What's the timeline? Is it an additional 4 years, an additional 6 years?
Okay, yeah. So the pharmacy program in general is a 4-year program. So that's why I say 6 years. Some, again, it's the 2 years potentially of your prerequisites, and then 4 years of pharmacy school. And in pharmacy, and to speak more on the credits, there's no really, we have a really like a rigid program, because I will say that the pharmacy program is there's a lot of information through it, and so there's no adding extra courses here and there and making, finishing up in 3 years instead of 4. It's really just a 4-year program across the board. And to give an insight of kind of what those 4 years look like, the first 2 years, or the first year, is really going over your basic sciences. So going over biochemistry, going over anatomy and physiology, really setting the foundation for your medical and your science knowledge. Then in your second year and your third year, that's when you start to really go into the pharmacy courses. So that's when you're learning about disease states, learning how to treat them, the medications for them. And then your third and fourth year, we start to sprinkle in some experiences. So you start to go out in your third year to rotation sites, go out to hospital systems, and really practice pharmacy. And then your fourth year, it is no classroom work. You are just out and about in DFW or wherever you want to set up a rotation site. You're out practicing pharmacy. And so that's the cool part. You get to utilize all you've learned in the last 3 years, and get to go practice it out in real patient care.
I'm happy to, Zach, I have a table that's got all the prereqs for all of our programs. Is it okay if I put that up?
Absolutely. I was just looking for one, so that's perfect.
Okay. Can everybody see that okay?
Yes.
Okay.
And so for the pharmacy, there is a page and information on Farm Direct. Like, there's an application that's kind of geared towards early college, high school students with that. That's still in play, correct?
Let me.
Yes.
I can ask. Okay, I'm about to say I'll ask Zachary.
Yeah, I'm about 90% sure. Personally, I don't oversee the pharmacy program. I deal with our undergraduate students more. So I do know a fair bit about it, but that was one of those more specific questions. But I'm about 90% sure we still are.
And what I will do is I'm going to drop a link into the chat, and it is a great thing. So if pharmacy is something that may be unfamiliar to you, it's something that you can go to and you can look at, and it has things as far as what do pharmacists do, or what do pharmacists do. There's other resources for people interested in pharmacy, and you can kind of see what there is we can do, opportunities, applying. There's a lot of different resources.
Awesome. Well, thank you, Dr. Benavides. I really appreciate both our faculty coming out and talking to us today. If there are any more questions regarding undergrad or pharmacy, feel free to put them into the chat or raise your hand. But before we end it, I do have a few more things I want to share with y'all. So I don't have slides either as I am traveling still, but I did want to share that we also just opened our brand new College of Nursing. So our College of Nursing is officially going to be opening up in the fall. And right now we are offering one program that is suitable for kind of this group, and that would be our RN to BSN program. So if you are interested in getting your nursing degree with us, there are a few different options you can do. So one of the options is, I'm sure you've already all taken a few of the prereqs for those programs. So while you're here, the next option would be to look into a program nearby. So something like TCC or Dallas College or UTA, and start getting your associates of nursing. I know that all of those programs have really great advising as well. So with that associates, you're able to apply to become an RN. Once you are a fully licensed RN, we would love to have you on our campus as a RN to BSN student. It's a fully hybrid program. So all of your courses are going to be online with a few different clinical opportunities coming up in person on our campus. Again, that program is brand new this year, and I know that a lot of you aren't fully into your associate's level of classes yet. But if you are interested in doing an associates of nursing, I would love to talk to you more. So I will put my email in the chat. Thank you, Dr. Kerr, for putting that in the chat as well. I will go ahead and put my email in the chat, and you're more than welcome to email me with any nursing questions. And while we're here, I also wanted to mention our new PATH program. So I oversee the PATH program. Stands for Providing Access to HSC. We actually have one TAB student currently in it. I won't say names just for privacy reasons, but we do currently have a TAB student involved in this program. And this really is an undergraduate program designed to help provide access to HSC is what PATH stands for. So it is a great way to, if you're interested in any of our programs, to kind of jump in, get your foot in the door and learn more about the program. We meet virtually twice a month and have various professional developments. So our next meeting is going to be on how to be ready for grad school. And then we have classes on resiliency. We're going to be bringing in faculty from other programs, so faculty from the undergraduate program and from pharmacy, probably starting in the fall, to help do some co-curriculars. And this program is only for undergraduate students and only for undergraduate students from partner schools. And we do want to let you know that TABS is absolutely a partner school of ours. We would love to work with you more. So this program, again, it's free to students. It involves a co-curriculars once you are a rising junior. So I know a lot of you graduate as roughly sophomores in college. So once you're a rising junior, we would love to have you come to all of our events on campus. And then after your junior year, we would love to have you on our campus in the summer for a 10-day internship that is fully planned by myself and a member of our staff as well. So this program is absolutely, again, it is free. It is very low stakes. It's just a great way to come in, engaged in our program. Some of the benefits are that you get to meet with our faculty and our staff. You'll be assigned a mentor for your program of choice. So if you are interested in pharmacy, or interested in biomedical sciences or medical school, I'm actually going to get a student from those different classes to kind of help mentor you, kind of let you see a day in the life of what that program looks like. Help you prepare for any interviews, things like that. It's just kind of another resource to have. So when you get on campus, you also have a friendly face. Along with that, we also have, we are also going to do a celebration gala at the end of the year. So as our seniors graduate into our programs, we're going to introduce them formally to all of our faculty from that school, let them know that they'll be applying. You'll get the opportunity to meet those faculty, and then we'll also actually grant you a free application secondary waiver for our school. So most programs have a primary fee through the CAS system, and then we also have a fee for HSC. So we will waive that fee for you, and then we will, again, really work on getting you into our programs on HSC's campus. And then once you're here, you would take over that mentor role. So once you are enrolled in HSC as a pharmacy student or as a TCOM student, PA, PT, whatever your interest is, you will then serve as a mentor to the students coming in. So it's a really full circle moment. So right now, this program is brand new, so you would get to be part of the inaugural class, meaning that you would get to be the first person to experience all these benefits, and then you would be able to be one of the first classes of mentors coming up. So Dr. Kerr did put the link to that as well in the chat. So thank you, Dr. Kerr. And again, I'll put my email in the chat if you have any questions about either nursing or the PATH program. I'm also open to questions about either right now.
And I went ahead and put my email in the chat too. So if you have any questions about pharmacy school, I know 4 years after, after undergrad or even after your prereq seems like a whole lot. I will be the first person to say after going through it, first person in my family, I'm actually a first generation college student. So definitely first person to go through pharmacy school. I can say it flies, but if there's any other specific questions about pharmacy or about the graduate stuff, please do not reach out or don't hesitate to reach out. We have shadowing opportunities that we just set up through our HSC clinics, and so if you want to come to campus, see what our pharmacists do, please reach out to me here. I'm more than happy to set up some times that you can go shadow our awesome faculty here on campus.
And again, I just want to thank both Dr. Kerr and Dr. Benavides for being here today. It's a great opportunity for the TAB students to kind of get an inside look at what HSC looks like. This is really what all of our faculty are like. They're so willing to reach out and help you. We are here to build you up. We are not here to just simply, come to class and leave. These faculty are really invested in your life. So we are here to help you succeed and really get you on that path to your future. So again, thank you both for being here today.
I have a question. So, Mr. Benavides, I don't know. What dates would I be available? Would you be available for me to shadow and stuff?
Yeah, so there's all different dates. So we set up with our faculty. I've set up a calendar with them to put some availability for their shadowing. And so if you're interested in, you can reach out here. And we can try to get you set up that way. And so there's just some days if you're thinking of them. It's really anywhere from, I think, Mondays through Thursdays or Tuesday through Thursdays. I can't remember what our faculty decided, but there's days in the middle of the week, anywhere from the morning or the afternoon. It can be 4 hours at a time. It can be 2. There's all different ways we can set up. Yeah. So if you want to shoot me an email, say what your information is, and I can see if we can get you set up.
Okay, and then also, is there a specific grade level you have to be able to shadow?
I will have to look at some specifics. So if you can include in your email what grade you are, then I can make sure it's going to be okay.
Any other questions for our faculty or myself today?
Thank you for taking time today. I appreciate you speaking with our students.
My pleasure.
Thank you. Thank you for the opportunity as well. We would love to always talk to your students. So we appreciate you giving us this opportunity.
Yeah, the pleasure is all ours.
Well, we have a great partnership together, and I'm excited about the bachelor programs for sure.
I did put in the chat, because I can't minimize since I am recording. It's under the early assurance Farm Direct. So if a student is interested in what that looks like as far as coming out of our program, looking at those prereqs, there's some links that are on y'all's webpage, but it's under early assurance Farm Direct is what it's called.
Thank you. Yeah, we have we have an admissions officer that works specifically with pharmacy because it is a different beast. And so that's why I have knowledge of my own program, I promise. It's just it's a lot different coming from, there's a lot of nuances to that coming to it. So, but thank you for providing that link. Appreciate it.
The other piece that they were going to present on for parents and students, just to give you an FYI, is the JAMP program. They do have one at the Health Science Center. I asked them to table that for a minute because we have an actual presenter coming April the 22nd. And that JAMP program is something that students start once they are in their undergraduate program. But early college, high school students, if they've met the requirements, can jump in a little bit early. So they actually apply between the summer of their graduation from us and their first year of college. But we have a speaker solely for that on April the 22nd. JAMP stands for Joint Admissions for Medical Programs. And it kind of gives some mentorship, some opportunities, some things that kind of really help create a great atmosphere in the undergraduate level to prep for those med schools that they're going to be applying to. And there's definitely some perks with that. So if you would like to hear about that program, please join us on April 22nd. And I will go ahead and close. I'm going to stop recording.